It is important to know how to control bleeding in an emergency. Taking the proper action quickly at the scene of an accident can save a life. Bleeding or hemorrhaging from wounds at certain points in the body can cause death quickly.
If the principal arteries of the neck, arm, or thigh have been severed, death from hemorrhaging may occur in 1 to 3 minutes. A rupture or cut of the main trunk of arteries of the chest and abdomen can cause death in less than 30 seconds. To more effectively treat a person who is bleeding, some knowledge of the body's circulatory system is helpful. This system consists of the heart, the arteries, the veins, and the capillaries. Through this system, the blood is carried to and from all parts of the body to supply nourishment to the body's tissues and to remove waste products. If the supply of blood is cut off for an extended period of time, the tissues in that part of the body will die. The blood is moved through the circulatory system by the pumping action of the heart. The heart keeps the blood flowing steadily under pressure to the most remote tissues in the body. The heart contracts about 72 times a minute. These contractions, or heartbeats, cause the blood to pulse through the body. This pulsation can be felt and can be best measured at pressure points such as the wrist. Pure blood leaves the heart through a large artery called the aorta. It branches off through smaller arteries to different parts of the body. These branch arteries narrow and spread into thread-like vessels known as capillaries, which extend into all the body organs and tissues. After the blood has furnished oxygen to the tissues and organs of the body, it collects the waste products and carbon dioxide and returns to the heart through a network of blood vessels called veins. As it returns, it passes through the kidneys, which act as a kind of purifying plant, removing the waste products. When the blood reaches the heart, it is pumped into the lungs where the carbon dioxide and any remaining volatile waste matter is exchanged for oxygen. It then returns to the heart where the cycle begins all over again. When blood oozes slowly from a wound, capillaries have been cut. There is little cause for alarm here since the amount of blood that can be lost is small. The application of a sterile pad or bandage to the wound will normally stop the bleeding and allow the blood to clot. When dark red blood flows from a wound in a steady stream, a vein has been cut. The carbon dioxide and other waste products in the blood give it a dark color. To slow the flow of blood and promote clotting, apply sterile gauze or a compress directly over the wound. If bleeding continues, apply pressure to the vein at a point below the wound, on the side of the wound away from the heart, to shut off the flow of blood. When blood spurts from a wound and is bright red, an artery has been cut. The oxygen in the blood gives it a bright red color. The flow from an artery comes directly from the heart and will pulsate with the heartbeat. It does not clot easily, and the flow is fast and strong. To help the blood clot, it must be slowed down either by applying pressure directly to the wound or by temporarily squeezing the artery shut at a point between the heart and the wound. There are 22 pressure points in the body, 11 on each side, where digital pressure can be applied. At a pressure point, the artery passes close to the surface of the skin and also over a bone. To control the bleeding, you apply pressure, squeezing the vessel against the bone at the pressure point on the side nearest the injury. Let us consider arterial bleeding from a scalp or head wound first. Here, the temporal pressure point is used to control arterial bleeding in the head area. It is important that this point be used for brief periods only, as it can cut off blood to the brain and cause damage if held for an undue period of time. To stop the flow of blood from a cut in the face, the facial pressure point is used. This point is located in the notch along the lower edge of the bony structure of the jaw. The carotid pressure point will control major bleeding of the artery as it passes through the neck. It is the principal source of blood to the brain. It also should not be used for more than a minute or two. The pressure point that should be used only in extreme cases, such as amputation of the arm, is the subclavian pressure point. It is located deep behind the collarbone in the sink of the shoulder. To reach it, you must push your thumb through the thick layer of muscle at the top of the shoulder near the neck and press the artery against the collarbone. For wounds just above the elbow, the brachial pressure point in the upper arm or the axillary pressure point in the armpit are effective. Here, the artery just under the upper arm is pressed against the bone from underneath. One of the most effective pressure points for cuts on the lower arm is the brachial point at the elbow. This is where the artery is very close to the surface as it passes over the large elbow joint. To control bleeding from a wound on the hand, the radial and ulnar pressure points at the wrist may be used. There are two, so both must be used at the same time. For major wounds, including amputation of the leg, the femoral pressure point is used. Here the artery passes inside the upper thigh. It may also be applied at the lower thigh. Temporary control may be achieved by pressing the artery against the bone. For wounds of the lower leg, foot, or toes, the popliteal pressure point at the back of the knee is the most effective point for controlling bleeding. The artery passes close to the surface of the skin over the large bones in the joint. When a blood vessel has been cut, position the victim in a way to decrease the force of blood flowing to the wound. Apply direct pressure with a sterile compress or gauze. This will help the blood to clot. Limit movement, since too much movement will increase the heart action, causing the blood to flow faster and interfere with clotting. Give the victim plenty of fresh air. Sips of water may be given to a conscious person if desired, and keep him covered and warm. Do not give him any stimulants while he is bleeding, since they increase the force of the heart action. Direct pressure with sterile gauze or other clean material will slow the flow of blood and promote clotting. However, if bleeding is severe, digital pressure on the affected blood vessel may also have to be applied to slow the flow of blood. When direct pressure does not stop bleeding, a constricting bandage may be applied. The bandage is placed as near the wound as possible, between the wound and the heart if an artery is cut, or below the wound and away from the heart if bleeding is from a vein, as in this case. It does not have to be over a pressure point. Bring both ends of the bandage around the leg, cross, and again pass them around the leg, making 2 wraps. Draw tightly until the bleeding stops and then tie. Never permit a constricting bandage to remain tight longer than 10 minutes without periodically loosening it. If bleeding persists, tighten it again. When bleeding is so severe that application of direct pressure or a constricting bandage is not sufficient to control it, a tourniquet can be used. A tourniquet can clamp off the entire blood supply to certain parts of the body and cause extensive damage to the skin and underlying tissue. Therefore, it is used as a last resort only after other methods have failed. If there is delay in getting the victim to a doctor, loosen the tourniquet after 10 minutes. If bleeding begins again after loosening the tourniquet, retighten it at once. When medical help arrives, tell the doctor or whoever must take charge of the patient when the tourniquet was applied and how long it has been in place. Tourniquets are normally used only where there is an amputation or where large arteries have been severed. A deep wound high on the arm or an amputation at the upper part of the arm requires a specially applied tourniquet at the armpit. Place the center of the cloth in the armpit over a well-padded object. Cross the ends of the cloth over a pad at the top of the shoulder and carry the ends around the back and chest to the opposite armpit and tie over the pad. To tighten the tourniquet, insert a small stick or similar object under the cross in the bandage on the shoulder and twist until bleeding is controlled. Internal bleeding is a condition that is often difficult to determine because there are seldom visible signs of bleeding on the body. It may be caused by rupture of internal blood vessels due to deep bruises. Usually the victim will display the same symptoms associated with shock: a dull, chalk-like appearance of the skin, dazed, vacant look, feeble and irregular breathing, weak and rapid pulse, and possible loss of consciousness. If internal bleeding is suspected, apply cold cloths or ice to the area where you think there is internal bleeding. Keep the patient warm. Cover him with blankets, coats, or towels to reduce the severity of physical shock. If he is lying on a cold, damp surface, place a blanket or coat under him. Do not give stimulants, and most importantly, summon medical aid immediately. Quick and correct action in an emergency may not only save the day, it may save a life, maybe yours.